All right, Walker, I'm really excited about this this episode. Who do we have this episode?
So we have none other than Spencer Hamilton, and I'm psyched.
Yeah, me too.
Yeah, we've been talking about this for a while. I feel like we're psyched for different reasons.
Yeah, I'm really interested in his injury, and you're psyched because he's your friend, right?
Yeah, he's my friend, and I'm a big fan of his skating. And yeah, we go back. I mean, we got on KO around the same time, and you know, he's one of those skaters that from the first time I saw him, I just thought like, holy shit, this is one of the most impressive skaters I've ever seen in person. Because there's skaters who will be impressive just in general because they're amazing, but then seeing them live is like a whole different thing. And Spencer was one of those skaters where it was like, I'd been seeing a lot of pros. I'd started skating kind of like in the industry or with people, you know, and Spenny was one of those guys where I just thought like, whoa, I got to step my game up if I want to even try, if I want anything to do with this skating thing. And
that's sick.
Yeah. And it was so long ago, and he remains that gnarly.
Yeah, it's so crazy. And you know, I of course, from a PT point of view, was interested to hear his story behind the serious injury that he's been, or the back problem that he's been dealing with for the past several years.
Yeah.
And we get into it in the podcast, but what I appreciate about Spencer's career is it seems like he's been putting out solid, consistent footage throughout his whole career. And, you know, we come to learn that he's been dealing with this serious back issue for the past, you know, 5-6 years.
Yeah, and you'd never know from his output.
You know, and I'm kind of an outsider looking in on the skate world, but I would have never known.
Yeah.
So after talking with him, I even had more respect for the content he's been able to produce over the past several years while battling this back problem. He's talked about it on a couple different podcasts, but you know, they kind of just touched on it, but didn't dive deep into this back issue that he's been dealing with. So I kind of wanted to have him on so we could, you know, learn more about his story, about, you know, how he got diagnosed, you know, what his problems were in getting diagnosed and treatment and so on and so forth.
Yeah. No, it's super interesting.
Yeah, so that's one of the many reasons why I was excited to have Spencer on this episode. And, you know, another reason is in my opinion, Spencer's probably one of the best skaters to come out of Canada, at least in our generation. Would you agree?
100%. Yeah. I think Spencer.
He's up there at least.
Spencer will go down as one of the greatest Canadian skateboarders for sure.
Yeah. So in that spirit, to pay homage to Canadian skateboarding and Canadian skateboard videos, I thought it'd be cool to do. I thought it'd be fun to do to list our top 3 favorite Canadian video parts.
Yes.
So both Walker and I did a little bit of homework. We put a little bit of thought into this, and we'll list our top 3.
Yeah.
So you got yours ready? You got your list ready?
Assignment. Yeah. This is good. This was good. So it was a little daunting at first because there's so many epic dudes I've watched over the years. But the first one that I thought of, and after, you know, like going through and watching a bunch of other parts, he remains up there, the top 3. Ted DeGrow in North.
So this is your number 3.
Yeah. No,
okay.
It's hard to rank them, but I guess I'll put it there. Ted DeGrow in North. He skates an RJD2 song.
Nice.
It was probably the first time I saw him skating, or probably the first time I saw any footage of him, and it just blew me away. Like, I didn't know a skater could be that technically good, that casual, like his not like frontside flips, just everything. It was just like the whole package.
Yeah.
That's
a good choice. That's a good choice. Yeah, I remember that video part. Cool. All right. So that was your number 3. My number 3.
Let me just give one shout out though to his nollie frontside heel flip at the end. I don't know if you could picture it. Basically catches it like vertically. Oh, it's a thing of beauty.
Was it down a stair set or was it over?
No, it was
something?
like a bump. It's like a prop up bump over a
Oh yeah, yep.
So
I do remember that.
So yeah, that's just like, it's like plays in my head constantly when I think of him.
That was the standout trick in your mind from that part? Yeah.
Yeah.
That was a good one. Cool. All right. So my number 3 is Wade DeSarmo. And
good choice.
As far as I know, his first full video part that he produced, Wade DeSarmo. It's a shop video. I think the name of the shop is Top of the World, and the name of the video is Top Dollar. So his part in that video is my number 3.
So good. Can't talk about Canadian skateboarding without mentioning Wade DeSarmo.
That's true. Yeah. Yeah, I love it. Was powerful skating. I love the song. I love the song with his skating. And I watched this video part a lot when I was living in Thailand.
Yeah.
And at the time, I was doing or trying to learn, how do I name this trick? Backside 180, switch nose grind, 180 outs. Did I say that right?
Yeah. Backside 180, fakie 5-0.
So, yeah, sure. So I was really into that trick. No, backside 180, switch nose grind. Yeah.
No, backside 180 nose grind. That's how you say it.
Perfect. Yeah. So I was really into that trick at that time, and he did several of them perfectly in that video part. And then the first time I saw a backside 180 kickflip 180 out version of that trick, he did a couple of those in that video part too, and I just became obsessed with learning that trick. And I ended up landing one, but that he inspired me to kind of learn that trick. So yeah, that's my number 3.
That's cool. And I think Spencer's even in that video. He has like a little Grom part.
Oh, nice.
Yeah.
Nice.
But yeah,
nice.
no, Wade is the best.
Yeah.
I feel like that part really like shocked the skateboarding world when it came out.
Did it?
I think so. Yeah.
Yeah. Yeah, and he had, it was kind of the start or the middle of the kind of Canadian baggy double XL era.
Yep.
But I feel like he did it. I like the way he did it. He did it, but it wasn't too much, and
somehow
he had a couple
tastefully.
Clips. Yeah, and he had a couple clips wearing Jordans, which I loved. So from start to finish, love that part. So that's my number 3. What was your number 2?
Number 2 is Galia Mamalu.
Ooh, nice.
And the video is Dark Star Battalion, which
nice
is a very underrated video. I feel like there were some banger parts in that Dark Star video. I mean,
Chet Thomas, right? Was it the Chet Thomas era?
But Galia skates to Andre Nicotina, and it is like he is so far ahead of his time with his tech handrail tricks. He gets big handrail tricks in there, and he just had the illest style. And I feel like you never saw much of him in the preceding, or the next few years. He had a digital part, but I mean this video part, like nollie heel back lips down rails, like it's a banger. And I feel like the song, I don't know how you felt about Andre Nicotina growing up. Were you a fan?
A fan, but I don't think as much as you.
No, I wasn't a fan. That was the thing.
Really?
I wasn't a big fan. Andre Nicotina was like pop music to me. Not like it was, because it was just so popular. Like it was not pop music, mainstream. It was like so mainstream. And I'm like a basic bitch when it comes to music, especially rap. But for some reason, it was just everything, all anyone listened to. But him skating to it
worked
and warmed me even to the song. So it just like holds a place in my heart.
Nice.
Fond place in my heart. I love it.
Nice. And I feel like him and Paul McEnroe would like feed off of each other, right? Because didn't they both ride for Dark Star at that time?
Oh yeah, probably.
Yeah. So they were the Canadian handrail monsters of that era.
Yeah.
Cool. I like it.
So what about you? Number 2.
My number 2, Travis Stenger.
Stenger, I think. Yeah.
Stenger.
Good choice.
In Modern Love. Do you remember that video part?
Yeah. Was
Love
it the
that
one
video
with the
part.
kickflip back tail shoved the other way?
Yes, that was his ender on a really tall ledge, and I think it was an Ice Cube song that he skated to. He was skating really tight trucks, skinny boards, and he had the sickest style.
Nice.
So that was another video part that I watched a lot when I was living in Asia, and I would watch that part. I probably watched that part 100 times that year that I was in Asia. So that was a standout part for me.
So good.
Yeah. So number 2, Travis Stenger. I hope we pronounce his name right.
I know. Same for me with my number 2 pick.
Yeah.
All right. So then you're gonna laugh at my top pick.
All right. Let's hear number 1, dude.
I mean, we can't talk about Canadian skaters without talking about Mark Appleyard.
That's true.
And
that's true.
The part is, did you ever see his digital part?
Maybe. That
He
doesn't ring a
Bill
bell.
Withers, Ain't No Sunshine.
Nice.
And you can't even find it on YouTube because
I was going to say, I bet that's hard to watch
everywhere. Now. Yeah, I can't find it. But I must have watched that part like 1,000 times. And it's basically all his leftover footage from Really Sorry, which is probably Mark's like best part if you really rank them, which I love. I love all of his parts, but for some reason just that, like, because you can tell it's just all so easy for him, and he makes everything look easy, but even the easy stuff, I don't know, it's just lovely. I love that part so much.
And I can picture his skating to that song going really well.
Yeah, so that's my favorite.
Wow, damn, that's your number 1. I like it. Random, but I like it. I back it.
Yeah, and who knows if it even qualifies, because I'm pretty sure it's all Southern California. But we didn't have stipulations about where the Canadians were skating, right?
We didn't. The fact that I don't remember that video part, but if it's all Southern California footage, that's a little sus. But we'll let it slide because it's Mark Appleyard.
Yep.
All right, so you ready for my number 1?
Yeah. What is it?
Do you have any guesses? Do you have any clue?
It's probably Sluggo, right? In the RDS video.
Sluggo, RDS. What does he skate to? Britney Spears or something like that? I can't remember. Yeah. No, not Sluggo. My number 1, North 2, Russ Milligan.
Oh,
last part, Russ Milligan, North 2.
Yes.
Fucking love that video part.
Russ, dude, he is the best.
Starts out with the sound of the grind of his very first trick. I even forget what the trick is, but the sound of the grind I felt like encapsulated skating in Vancouver. Just rough spots, chunky ass ledges. But he starts it off with just a basic trick on a chunky ass ledge, and then I don't know, like he skates Vancouver the best that I've seen it skated. High ledges, great switch pop, and then his last trick, he does like a really long switch nose grind on a famous spot. You'd recognize it. It's kind of that curved downhill ledge close to the. I think it's close to the Vancouver Skate Plaza. Everything about his skating, loved. I became obsessed with the song that he skated to. I put it on my my iPod back in the day.
What was it? What was the song?
Oh, geez. I'm singing it in my head right now. I don't want to sing it out loud. Yeah. But I forget the name of the band and the name of the song. I should have been prepared for that. But yeah, everything about it I was obsessed with and watched it probably even more than the Travis Stenger part. So for those reasons, that part was my number 1.
Nice. I back it.
There we go, dude. Our first list.
Yeah. No, I'm into it.
Yeah.
I do feel like we're dating ourselves pretty hard, or it's like showing our age, because
just because the era
they're all
we
like
chose
20
from?
years old. Even my picks, which makes sense. It's like formative years, influence.
Yeah, and also that was the era where skate videos were really important, and we watched them all the time and memorized them and so on and so forth. So
yeah, no, this is good. I'm excited to revisit yours. Any Russ Milligan part is like gold to me.
So good. Yeah. So good. Do you have any like modern Canadian video parts that are your favorites that come to mind?
I mean, modern favorite. We can't talk without mentioning Bobby DeKaiser.
Yeah,
Like,
that's what I was gonna say.
yeah.
What's your
And
favorite DeKaiser part?
it's tough. The one I find myself watching a lot is a random one. It's his trans world part.
Oh yeah,
Something about his skating just looks so natural. Looks like
Yeah.
they just went out and had fun. Every trick is popped, like 4 decks high. It's just so good. That or his quasi intro part.
oh nice,
Super good. Yeah.
yeah. The DeKaiser part that stands out for me is the Converse video Purple.
Yeah. So good.
I love that video part. Another video part that, these days I don't watch video parts a ton of times,
Right.
but that one I did. I watched that part,
Yeah,
that video,
seriously.
but also that part quite a bit. So that's probably my current favorite that I can think of.
Yeah.
So,
Cool.
all right, dude. Well, let's get into this episode, shall we?
Yeah, let's do it. Spencer
I'm-
Hamilton.
I'm psyched. Spencer Hamilton. We get into a lot of stuff, but basically we do a deep dive on this back issue that he has called Ankylosing Spondylitis, and it's a rare sort of back injury, I guess you would call it, that he's been dealing with for the past several years. So I'm excited for us to learn more about it.
Yeah.
So
All right, well, let's get into it. And if
it.
you want to support us on Patreon, we much appreciated. We have so much content there.
Yeah, support us on Patreon. If you're supporting us already, thank you. Thanks to all of our supporters. If you like what you hear in these podcast episodes, consider becoming a Patreon member. We have content, video content, podcast content, all related to injuries that skateboarders deal with and how you can deal with them and come back from them better and stronger so that you're skating for longer and you're stronger on your board. So if you like what you hear on these podcasts, consider becoming a Patreon subscriber.
Right on. All right, well,
Let's get to it. All right.
Well, dude, can we get into your back injury that I know you've talked about it a lot, but can we go into that a little bit?
For sure.
Yeah, Kyle is so excited.
Yeah, I never talk about it with anybody who's like, I hesitate to say interested, but 9 Club in the bunt, you're not necessarily talking to people who are.
I thought they did a pretty good job at like asking questions, but like the few times you've talked about it, I'm like, oh, I want to ask him this. I want to ask
True.
like, more shit,
Sick. Well, I'm excited.
Sweet. Yeah, let's get into it. Before, I kind of want to hear the backstory on how you arrived at the diagnosis, but can we give the diagnosis straight off the bat before we do that?
Yeah. It's called Ankylosing Spondylitis, which is abbreviated as AS, but
And what's the basic meaning of that?
I could have brushed up on. It's one of those things that I've read. Well, when I first got it, obviously I did enough reading, and now I just if you asked me to describe exactly what it is, I don't even think I could do a great job. But essentially, your immune system is overreacting. Why? It's not really known. Overreacting in the sense of creating inflammation in a joint generally. So rheumatoid arthritis and ankylosing spondylitis are pretty similar. Your immune system creating inflammation in joints. Ankylosing spondylitis is generally lower back, and the worst case scenario with chronic inflammation of your vertebrae can cause fusing of your vertebrae. And my understanding of that is with medication that they offer, it doesn't necessarily reduce your chance of that happening. And I don't think it's very studied in modern medicine. So I think over the next 50 years, I could see us understanding a whole lot more about it. But I think it's unclear whether medication and physiotherapy can actually prevent that fusing or not. Of course, I'd like to believe that it can.
But the idea is that it kind of slows that process down, right? The combination of those two things. Is that the idea?
I think so. And so again, not everyone with AS will have that outcome
Mm-hmm.
or that, I guess, increased potential for that fusion. So again, like it's a slippery one to even get diagnosed with, because some people, they test you for a protein HLA-B27, and some people have that but don't show any signs of symptoms. Some people can get the diagnosis without showing that genetic marker.
The basic idea is that in its most basic form, it's an autoimmune situation, but it presents itself as like an inflammatory arthritic condition in the spine. Is that kind of the basic idea?
Yes. Sorry, my brain was all over the place, but that's it. It's your immune system creating inflammation in joints.
Okay. Does that make sense, Walker?
Yeah. And the first question I would have that you might not know the answer to is, does it ever show up anywhere else aside from the spine? Do you know?
They ask that consistently. I'm not sure with ankylosing spondylitis if that's like a classic characteristic. For sure, rheumatoid arthritis, it can happen in any joint, and people have it in several joints.
It's much more rare for ankylosing spondylitis to present itself like in the knee or the shoulder. I mean, it can happen, but it's usually in the spine, based on my limited understanding.
True.
And Spencer, I understand you kind of had a journey in getting to that diagnosis. Can you tell us a little bit more about kind of that whole process?
It was fucking frustrating. Like the whole thing. And I to be fair, I got lucky with having the time, having support, a whole combination of things that allowed me to seek different treatments. Even though nothing worked, it led me to eventually the right physiotherapist's office, who said, look, man, this sounds a lot like what my friend has.
Wow.
You should go get a blood test. And that's really what it was that did it. Was just first try at a new physiotherapist who was like, because again, I'm at this point, it's kind of like a checklist for diagnosing, okay, you have this genetic blood marker, that's one thing, but which things are you presenting? And at the time I'd had a bout of iritis, which is just an inflammation of your eye. So another kind of autoimmune disorder, I guess.
So that was like another little clue.
Yeah, back's fucked for a couple of years at this point. Well, I might as well fucking start at the beginning.
Yep, let's do it.
Yeah, I was going to Barcelona for a trip in 2014, and all of us at this point too, like I have kind of some theories on what happened. I'd been definitely living a little too fast, a little too much drinking, partying.
Like the rock star rookie pro you were, dude. It's all good.
Exactly. And as I started to kind of like not really started to just kind of distance myself from that, drinking less, that's when this all happened. And I've heard of situations like that are similar, where like, it's kind of, that's the glue that's kind of keeping you together. And once you slow down, it's like, oh, your whole body's kind of like, we've been holding on to this for a while. Here you go. Because they do say some environmental trigger could happen. Anyway, it's all a hypothesis to me. But that coincided around the same time of like tapering off with this, and then this onset of symptoms. And it started in my right leg, basically like around my right hip area and into my right leg. Just felt really, really tight. Like I had a wicked knot. And at the time, I, always enjoyed going to get massages and stuff like that. I've always had pretty good results when being super tight with getting massages. So I was kind of like, okay, it's a good knot. Let me go get some work done on it. And just like zero effect from the massage. If anything, it just made it worse, kind of inflamed it, whatever. And at this point, like most of the pain was almost like where I've started to go down the route of like, is this like a piriformis syndrome thing? Like you start kind of self-diagnosing, and because that was kind of where the pain was.
Can you guys translate that for me real quick? What you, because Kyle was nodding, but I don't know what it means.
It's a condition where some nerves in the hip area get irritated and you have pain in your butt, pretty much.
Yeah.
Okay.
Your piriformis kind of attaches from your spine to your hip, and some people's anatomy, like a nerve runs through your piriformis, I think. Is that?
Mm-hmm. Yep.
And so if your piriformis gets super tight, then it squishes on the nerve. And again, kind of playing Dr. Google for myself and looking at all different things that kind of made sense anyway. And so that I went to Barcelona thinking, yeah, my shit's still kind of fucked, but this had only been like 2 weeks or something. So I'm like, okay, obviously I'm going to still go on this trip. I'm not thinking that this is going to be some long-term chronic situation. Get on the trip. I can't even like keep up with the people I'm with to go out for a day, like I can't push.
Wow.
So there was nothing. Yeah. Nothing else was going on.
It got that severe.
Yeah.
And there was no fall. There was no injury. This kind of came out of the blue.
Yeah. Nothing crazy.
It wasn't even like one session. You could tell yourself like, oh, maybe I had tweaked it or something happened that day I was skating. It was just like woke up and it was there.
There was a final session, but nothing happened, but there was a session where I'm skating and I'm like, this is starting to get tight. And then the next day I was like, okay, yeah, no, I definitely got to stay off of this and get some work done. But that day there was nothing like, oh fuck, yeah, I slammed pretty hard. That this makes sense. So yeah, in Barcy, spent a bunch of money on massage and some acupuncture there, and had no effect at all. Came back and just throwing money down the drain, going to chiropractors and massage therapists and acupuncture and fucking spinal decompression and just you name it, like sacral cranial therapy and a bunch of fucking magical shit that had zero effect.
Lasers? Did you go down the laser path a little bit? Laser therapy?
At a chiropractor?
Sometimes they do it at the chiro or the acupuncture office.
Yeah, no, I did have some laser at one of the chiros, which again, I'm just like, and I'm skeptical to begin. I'm just like, okay, whatever you want. Like, I'll try it all.
Kyle's very suspicious.
Yeah.
You tried all the stuff that oftentimes have large placebo effects.
There you go. That makes sense.
And they didn't do anything. Okay.
No, yeah, no effect at all. And at some point, it might have been like 6 months or something after the first onset of the symptoms. And again, like throughout this time, I'm kind of doing some light stretches, but nothing's feeling good. If I do anything, it basically aggravates it and makes it worse. So I just feel like I'm walking on eggshells. And at some point, I'm just doing like a classic, like seated on a chair and you put your foot up to your knee kind of hip stretch,
Mm-hmm.
And like all of a sudden, within like a day or two from doing this stretch, I kind of felt, and it could have no relation to this stretch, but for some reason, all of a sudden the stretch started to feel kind of good for the first time in a while. And within a few days, the pain was completely out of my right side, completely into my left side.
Oh.
Like my right side was like my strong side, like nothing had ever happened there. And now my left side feels exactly like my right side used to. And that was kind of the first red flag indication that I'm like, what the fuck is going on? This ain't right,
Mm-hmm.
Like, when do you roll your ankle? And then all of a sudden, like,
roll your other ankle.
Yeah. Like, I mean, of course, there's some like, compensation stuff, like, you have an injury for a while. And of course, you could expect some sort of like, okay, this other leg that's been bearing the brunt for the last 6 months. Yeah, maybe it gets too tight and needs some work itself. But this was like within a few days, there was like a little transition period where I'm like, oh, I'm feeling a little bit better, a little less aggravated. And then it was like, bing, all the way into the left side. And so that basically just kind of ping pong back and forth for whatever it was, 4 years or something until getting the diagnosis.
Damn.
And were there periods where in the shift it like didn't hurt at all, or was it always just sort of there?
There were a month, 2 months at a time here and there, like at times maybe 4 to 6 months out of the year I would feel all right. And I mean all right, like not great, but.
And is that when you would skate and try to get clips, try to get stuff done?
And that's when I would try to relearn some shit that I lost. And again, like at this point, I'm not cross training. I'm not doing anything. I'm feeling like I'm withering away because everything I do aggravates it. And I'm taking fucking naproxen and shit, you know, like I'm not on any sort of like legit long-term.
What's naproxen?
It's a leave. They put you on that if you have to take ibuprofen for a long period of time, they'll switch you on to naproxen because it's apparently a little better and can be a little stronger. I don't know. It did fucking nothing for my situation.
In this process, are you going to specialists and getting it checked out, or what's going on as far as figuring out what's going on with your back?
Yeah. So I'm in Canada and I'm working with this system, which everything's free, but some shit takes a little while. So I get my x-rays, I get a CAT scan, CT scan. I had fallen off a roof in a drinking accident where I fractured my L3, and that was in 2012. And I mean, I assume most skaters probably have some disc bulges. I don't know why they wouldn't.
Most humans have disc bulges.
True. Most humans have disc bulges and don't feel any pain.
Yeah.
However, when you have a CT scan and a bunch of doctors who aren't really looking at you like an athlete necessarily, they're just, okay, you're presenting signs of, you know, lower back pain. You have this L3 fracture that's still visible and disc bulges.
That's what's going on type thing.
Clearly, this is your problem, which I always had a sneaking suspicion, like in my head. So you're trying to make sense of it. I'm thinking, okay, my spine's like this. I've got nerves coming out and it's switching from side to side. Like, is a bulge on a nerve that's coming out? Is it teetering on one nerve and then going on to the other or something? Like,
did it make sense, their initial diagnosis, or did it not seem to add up? Like when you would get those explanations early on?
It didn't add up to me at all. No. But at the same time, it didn't add up, but I did kind of run with it too. And so another thing throughout this whole thing was actually just identifying what pain I'm having. At the beginning, for the first, I mean, up until actually getting the diagnosis, I would have bet my life that I was having nerve pain.
It sounds, so far, if you didn't tell me like what's going on now and you are just telling me just your story so far, that's what I would say too.
Right. So again, like I don't necessarily blame people for it because you're relying on some, like, I mean, it kind of goes to a broader thing of like relying on people to tell you how they're feeling and how unreliable that is, you know?
Yep.
I think a lot of people are like, I have sciatica and I have this. And I'm like, I don't know. You sure?
Yeah.
Maybe you want to investigate that a little further before you throw your eggs in that one basket. But
so you get that initial diagnosis, and I'm guessing they're like, hey, take these over-the-counter anti-inflammatories and do some physio, or what was your initial?
Basically, I mean, I heard more than once, go home and rest for 12 to 18 months.
What? They'd say that
what
kind
I heard
of thing?
more than once. Yeah.
That's crazy.
And then, so like, and I'm going, basically here, you have to go to your GP and you ask for, can I go see this guy? Can I go have this done? Can I go do this? So I didn't want to wait for an MRI. So I went and paid for an MRI. And that coincided with me having an appointment with he was some sort of like spinal surgeon. Forget what his actual title was, but my point in seeing him was exploring the nerve root block injection.
Mm-hmm.
And I got one of those and it had no effect. So that kind of helps as a diagnostic again, right? Like if you got a fucking nerve being squished and they hit you with that.
What is that?
Basically a non-steroidal anti-inflammatory.
Oh, okay.
Non-steroidal anti-inflammatory injection into this nerve, right?
Mm-hmm.
So I think it's something like that. So your fucking back is squishing a nerve. This this drug gets injected in. This nerve shouldn't be causing you any pain anymore. Now you can do some physio because you're not in pain, and hopefully the squish is lessened.
Yeah, so they do the injection, and then it gives you a window to exercise and rehab and create some like permanent change in the area, theoretically.
Yeah.
But that had no effect.
Zero effect. And so, yeah, at this point, again, like it's like every level every person you're seeing, you're just like feeling pretty fucking defeated, you know,
Bet.
like over and over and over, like, okay, what is, and I'm like going through all, like, am I infected with a fucking virus or something? Like, what is happening to me? So yeah, that the nerve root block didn't work. Pay for this MRI doesn't show anything touching a nerve. So now I'm starting to really start to be like, okay, this is definitely not adding up at all, you know? But I'm also like, I'm just getting worse. Like, I'm walking down the street with my girl. I'm like fucking like coughing, sneezing, anything hurts like crazy. I have to like stop, and I'm like pretty much just like collapsing into myself because stepping off a curb, all these movements, especially with no pain intervention, like it's your whole body is affected, you know, like, and it's not like, you know, body's affected as in like my shoulder was hurting or my elbow was hurting, but it's the middle of your body. And, you know, it does start to kind of, that's where the nerve thing, like, oh, like a lot of the time I just describe it as my leg is fucked, because like it starts up here, but like my whole, I can't put any weight on my leg at all. It's like every step is like a very conscious decision with where I'm stepping. And
So the symptoms are pretty severe.
yeah.
And then I can't imagine how even in a window when you are somewhat pain-free to skate, psychologically, like how are you even able to overcome like the fear of just like a wrong movement sending an extreme version of pain? You know, like I bet that was so gnarly for you.
Good point. Because when I remember going to see go to a physio place that offered some spinal decompression and using their machine, and then after just being like, I feel like I'm actually broken in half right now. I can't really move, and the guy's being like, no, you're good. You just like, you know, let me help you off the table, and me being like, no, dude, like,
Damn.
in my head I'm visualizing this fucking nerve that's about to just detach or something, you know?
Damn.
And so yeah, that was like, as I'm skating, I'm just like so thrilled to be skating, but thinking like, hey, what the fuck is actually going on in here? And am I doing any damage by skating? But like most arthritic conditions, movement when you're not in crazy pain tends to feel good. So I would, you know, kind of suffer through a bit of pain some sessions, and then find myself an hour later being like, fuck, I feel great.
You're warmed up.
Yeah.
You're loose. Yeah.
So that was 4 years of fucking back and forth with going to see random people, having a little bit of time to skate.
So started 2014. Between 2014 and 2018, you're slowly trying to navigate through the healthcare system to find the right diagnosis. And it sounds like you have, throughout this 4-year period, you have flare-ups where you can barely walk.
Yeah.
But you also have periods of time where you had these like windows where if you warmed up enough, it still hurt, but if you warmed up enough, you can move and skate and stuff like that.
Exactly.
Medications aren't working. Acupuncture, chiro, decompression, injections, physio probably isn't working a ton.
Everything aggravates it. So again, like when I'm going to physios and stuff like that, it's usually when I'm at my worst, or when I'm seeking help, it's usually when I'm at my worst. Nothing feels good, you know, and everything feels bad, actually.
So after the injection, what was the next step as far as the diagnosis journey?
So I did start going into, at some point, like naturopathic shit. So I got fucking prolotherapy. I got a PRP shot in my back. And that was all another waste of money and another just wasted journey of time and effort and all of that. And again, this whole 4-year period, I'm thinking this is a structural problem. So I'm trying to throw things that you would apply to a structural problem, not thinking that it's something that is just occurring. Yeah, not at all. I don't even think I'd ever heard of an autoimmune. I mean, my brother actually has Crohn's, but I wasn't ever thinking like in relation to my brother's Crohn's. Maybe there's a hereditary thing that I have as well or something. Later, my brother's like, oh, AS. That's like Crohn's of the spine. I'm like, true.
Damn. That is true. I never thought of it that way.
So funny, eh?
Yeah.
What's heartbreaking for me, Spencer, is just imagining at every turn the hope, you know, like, all right, I'm taking this PRP shot. This is going to work. all right, I'm doing this. This is going to work. And then just
Of course.
the fucking
Yeah.
defeat. Like, oh, I just can't even imagine that, like, ongoing.
Not to mention,
Yeah, money. And just like you're in your prime as a skateboarder, as an athlete. Like, you're just like, you can send it. You like are right there, like legs, body. I know what to do. Let's go skate. Like, let's do this now.
yeah.
I feel for you, dude. I can't believe you were going through that.
Let me ask you this, Spencer, like on the road to the proper diagnosis, because from what I understand, your symptoms like wax and wane no matter what. Like sometimes they're better, sometimes they're worse. That's just how it works, right?
Yeah.
Did you ever get like tricked into thinking like, oh, maybe this spinal decompression does work, or maybe this PRP does work? You know, like early on, did you ever think shit was working and then you realize that it didn't? Did you have any experiences like that?
Not even.
Oh, really? Damn. Okay.
No, like I could honestly say nothing. Like nothing was clearly like, and to be fair, like the only thing other than taking the medication I'm currently on that helped at all, or I did eventually switch on to Celebrex when I first got the diagnosis, and that certainly took the edge off.
Yeah, you said that helped a little bit. I remember you saying that.
Definitely. But was fucking just eating meat.
Helped. Interesting.
Like noticeable reduction in pain.
Strange. Yeah.
Interesting.
Yeah. And I mean, like 2 weeks only beef and water.
And had you been, because I remember you used to be a vegetarian.
Yeah.
Was that a like reason to switch? Had you heard something, or had you just like stopped being a vegetarian anyway at the time?
Yeah, no, I started already eating meat at that point.
Wow, that's fascinating.
Yeah. Which there's obviously, like anything, I'm sure some people with AS are diehard vegans and it works for them. Some people with AS are diehard carnivores and it works for them. I don't know. I didn't find that I don't think I actually tried to do vegan while I was on, maybe like a month actually. At some point I stopped eating meat for a month to see, but not anything like long term. And that didn't have any effect. But the carnivore thing, that's just not sustainable for me. I don't know. I don't have any fucking desire to eat. And I like steak. Well, that's the thing too, right? Like you eat steak for 2 days and your mouth is so fucking raw from chewing steak that you have to move on to ground beef. And to get your fats, you cook it in beef fat, beef tallow. And
it's not sustainable for a long period of time.
No, not at all.
Yeah.
And I mean, you do notice some interesting benefits, which I'm sure are kind of just characteristic of any elimination diet, but you shred down. I'm like, ooh, I'm feeling muscular, but I'm fucking starving all the time. Well, another weird thing, I noticed that within like a few days of just eating beef, I had to go to decaf coffee if I wanted to have a coffee.
Why?
It was like sweating, crazy over caffeinated feeling.
Like jitters?
2 days. Just like
Weird.
Immediate.
That'd be tough for me.
Well, I didn't need it. So I was drinking my decaf and I'm like, oh, whatever. This is like, with decaf, I don't know. I feel like there's still trace amounts or something. So I was still getting my enjoyment. I still felt like I got a little rise, but the coffee was not enjoyable at all because I was just like, oh, this is, anxiety. So you know how the fucking caffeine overload goes. But
damn, so it was just like too severe of a caffeine rush, so to speak.
Which I wondered, without carbs in your body, or like, whatever amount carbs are in beef, so minimal that I don't know if that has some effect on the way you metabolize caffeine or how the mechanism is. But
yeah, I don't know. That's interesting.
It was pretty immediate. And again, with all the things I tried, there was nothing that I had tried that I was actually like, damn, it was about 5 to 7 days of like just eating beef. I can't skate to like, I'm going skating. Whoa. So I get where people come from on that shit, and like whatever works.
Well, but here's a question. Do you think that just could have been the start of like kind of a quote unquote remission period of time where you're going to feel better anyways? Like,
who knows?
Or was
for
it
sure.
clearly?
Yeah.
Who knows? Yeah.
And I'm totally open to all that too, because I'm, I like being a skeptic. I don't know. There's so much chance within everything.
It just goes to show you how tricky sometimes these things are to really like,
Definitely.
hone in on.
Yeah.
And it sounds like you kind of fell into the idea of it being non-structural by chance, right? Can you tell us that story?
Yeah. So it did start with the iritis, which is basically I woke up one day. I felt a little something the night before, basically just like some light sensitivity. And then woke up in the morning to like a cloudy, rainy day, and it was just like unbearable to look outside. And I got my girl to drive me to the hospital because it was seriously like unbearable, you know, like my eye is just throbbing, like someone fucking punched my eyeball, and crazy light sensitivity. So I'm just like,
Just one eye or a little bit of both?
just one eye, my right eye. Yeah. I need an eye patch kind of thing. Like this is, now I get why people have eye patches. Holy fuck, this hurts. So go there, they basically like freeze my eye. I get some eye drops, and they tell me about iritis, which is just some kind of whatever term, you know, like iritis, itis, inflammation, iris.
Inflammation of the eye.
That's it, you know. We'll just put these two together, and this is what you've got. We don't know why it happened. We don't know when it's going to go away. Here's some drops. They gave me some drops to dilate my pupil. So for like a month, I'm walking around. One pupil's huge, the other one's normal, which is kind of weird psychologically too. Whenever you glance at yourself in the mirror, you're just like not feeling right, you know? So that was like a month. They did put me on prednisone as well. And this is the first time I went to see a rheumatologist. And he was, I mean, this is just a referral from my GP. But I remember talking to someone and being like, oh, you're going to see him. That's good. He's a good dude. And he tested me for rheumatoid arthritis. I'm in his office. He's asking me all this stuff. Oh, you've had like lower back pain for this amount of time. Okay, you're this age. Caucasian, iritis. Like, honestly, if you had a checklist for fucking ankylosing spondylitis, that's the fucking checklist.
Check,
all of them.
Yeah.
He didn't test me for that. He just tested me for RA. And this is like an issue where I it still kind of irks me, you know. I called him back when I eventually did get the diagnosis and spoke to the reception person, and the reception person was like basically like, look, I just saw this doctor not too long ago, and I feel like this is actually a year now that I think about it. This was a year difference. And because now I'm like, this cost me a fucking year getting this diagnosis because he just didn't feel like testing me for this other thing, you know?
Oh, so he missed it.
He just didn't test me for AS. He tested me for RA and not AS. At the time, I don't know what he's even testing me for, really, you know? I don't know what rheumatoid arthritis means.
But it was a blood test is what he did?
Yeah. And just didn't include that, which this is everything for him, you know? He's the guy, you know? This is the right guy to see for this type of shit.
Mm-hmm.
And he missed it. And not that it would come to anything, but I did call and basically like
FYI, you guys missed this.
Yeah. Didn't get to talk to him, but through the reception, basically being a middleman, was like, look, like I'm kind of pissed about this. This is wrong. You guys really fucked up. You missed this glaring issue here. And there was even a bit of pushback, like, no, he doesn't think that's right. And me being like, well, at this point, I had gone to see a different rheumatologist who had confirmed, and I'm just like, well, fuck, like, you can stick to your guns if you want, but you're full of shit, basically. Because I didn't really want to go back. Why would I go back to see this rheumatologist if he missed this glaring thing? And then so I saw this other one who put me on Celebrex, and that was like the first like, oh, fucking finally. And this is an arthritis medication. So I'm like, okay, this is not fucking nerve pain. This is arthritis pain. I start looking more into that, reading about all kinds of joint pain, and then it started to make so much more sense, right? Like, yeah, identifying pain. This is what's going on.
Did that rheumatologist give you kind of that diagnosis, or did he say, oh, just try Celebrex and see what happens?
No, it was a girl. She went through the whatever. Again, like, to get a diagnosis with this, it's kind of at their discretion because it is finicky, right? If you present this genetic marker but don't have symptoms, it's kind of hard to say for sure you've got this with autoimmune stuff anyway. I think that's kind of how it goes.
Yeah.
But that was the first diagnosis I got, was from her saying, you have ankylosing spondylitis. This is what you need to be doing. I kind of ran into a wall with her as far as treatment. At this time, I'm kind of like, I don't want to be fucking taking pills. I'd like to fix this with diet.
Just to pause real quick, Celebrex is the one you said you started with, the first one.
Yeah.
What is that general? Like, who generally gets that? I'm when you say arthritis, I just picture old people.
That's who gets it. That's probably their number one market.
Okay.
I bet you some listeners have seen Celebrex commercials, and it's probably an older person who's now playing with kids or something.
Kyle, you see a lot of older patients. Is that something that you're often like managing or not managing or?
Yeah, a lot of my patients take Celebrex for sure.
It's again, like kind of like if you're, my back hurts, ibuprofen, Advil. It's longer term, naproxen. It's chronic, Celebrex. That's kind of what they do. And there's other ones that are similar to Celebrex too. Celebrex is not like dominating that space. There's
it's one option for sure.
Maltotrexate or something like that other people forget. I probably didn't say that right. Methotrexate.
Why is it you don't want to be on it?
This is just me like not wanting.
Does it feel like it's like a very temporary thing and it's not really resolving the issue? Was that kind of it? Like it's just a mask?
It was a combination of that and just, not wanting to be reliant on a medication for long term.
Was one other factor is that the Celebrex helped, but it didn't get you to where you wanted to be physically as far as being able to skate on a regular basis? Was that part of it too?
Definitely. So it took a huge edge off and was absolutely a game changer in like, holy fuck, like I can kind of breathe again. I can start doing a few things here and there, like, like enjoying a little more consistency with skating and doing a little more exercise that I want to, and enjoying some yoga. Like, again, it almost felt like the nerve root block kind of thing, where like, oh, okay, this is freeing up. It's giving me a little bit of space that now I can work with,
Yeah.
But again, I'm getting flare-ups that are preventing me from skating still the same, maybe 6 months out of the year, I can't skate. It's just that when I'm having a flare up, it's not that debilitating. Like I can't skate, but if we were walking past each other on the street, you wouldn't be like, damn, this guy's going through some suffering. Whereas before, like, you see the fucking walk sign on a traffic light counting down from 10 and you're like, yeah, I'm gonna sit this one out. I'm gonna wait for the next one, like I can't move. You're looking at older people walking by like with a cane and a hunched back. Like I fucking feel you, Flair. Like I know what you're going through. So it got me to a point where I'm like, okay, at least I can, I'm not 100%. I'm not even fucking 70%, but I'm taking the edge off of it was huge.
So you plateaued with the effects of Celebrex, and then the next step was what you're doing now, right? Which is
next step was going on to biologics, which are an injectable immunosuppressant. So I didn't like that this was the end of the line with this rheumatologist. Basically like, here, let's try Celebrex. If this works well, but not too well, you can try this biologic. My brother, like I said, he had Crohn's. He went on a drug called Humira, which again, some listeners might remember these commercials. More than 50% of the commercial is talking about the adverse symptoms or potential symptoms, all kinds of cancers and all kinds of shit that you're just like, oh my God. Like
you basically have to accept some shit might happen to me if I take this.
Yeah. And my brother's experience wasn't good. He got sick quite a bit. I think he was getting like cold sores and just it's an immunosuppressant, right? So you're
weakening his immune system. Yeah, just anything comes in.
Exactly. Yeah. So you end up becoming more susceptible to all kinds of different things. Humira, I think, is a once a week injectable, maybe once every 2 weeks. So it's fucking annoying too, right? And these are not cheap.
Yeah.
These are expensive drugs.
Not covered.
I'm lucky because it does get covered, but I take a monthly injector. It's an auto injector. It's super easy. You don't even see the needle, but it's $1,700 per injectable.
Damn.
Yeah, round that up. And this is like the newer kind of synthetic ones. Whereas like I looked them up and just on Google and like I saw like $4,000 to $5,000 in the States.
Wow.
I don't know if that's accurate, but
you said you're getting covered through Canada.
yeah, yeah, thankfully, yeah.
That is so cool.
That's amazing.
I don't pay anything, which I was paying for the Celebrex before, which wasn't expensive, but it was like,
Oh shit.
this is nice, you know?
Still adds up.
It does.
Yeah.
Yeah. And how big of a game changer was this new treatment, or is this new treatment?
I mean, I wish in some sense that I had just gone on it way back then, because it would have saved me a ton of just fucking pain and agony, and just overall, I mean, when you're dealing with chronic pain is one thing, your body is one thing, but your mind is, it's a lot harder to deal with that, you know? Like, okay, when is this going to end? Is this ever going to end? Is this it? Like waking up in the morning, that's kind of the classic thing too, is the mornings tend to be the worst. You've been sleeping, inflammation just pools, your blood's not circulating. The opposite of movement feeling good is fucking sleeping. So I dread sleeping. I dread lying down. Waking up is a struggle. It takes an hour to fucking get myself to a point where I'm like decent, you know, like you feel like a hunchback, and every movement kind of hurts, and it's fucking miserable, you know, it's absolutely miserable.
Brutal. That's fucking brutal, dude.
Yeah.
And not to take it back to the dark times, but I'm always interested what you did to keep yourself happy and keep yourself upbeat. Like, what were you doing that was stimulating, and what were you doing to just pass the time? You know, I mean, you're in this tricky position of being so fortunate to be able to do the one, you know, the thing you love, the thing that you're revered for, skateboarding, but you can't do it. So what were you doing in this long, you know, in those bouts to like really keep yourself happy?
I don't know exactly when I started, like what year and month I started doing yoga, but that really helped to get out some energy. And a friend of mine owns a yoga studio close enough, and they do the hot yoga, the Bikram style, which conversation for another time. Obviously, the Bikram, not vouching for that fucking guy at all, but going into a hot room, an hour and a half, concentrating on breathing, doing your own kind of spinal decompression felt really, really, really good. And just having some kind of space that I can now go to, even though it fucking hurt the whole time, and it's 40 degrees, so 105 Fahrenheit, an hour and a half, a bunch of exhausting fucking poses that, you know, balancing stuff that just gets your heart rate jacked up real quick. But after, like, I don't know what it was, maybe 2 years or something like that of nothing, and then eventually being like, because this was definitely pre-diagnosis where I started doing it. But yeah, being in this hot room and having some outlet that isn't like, I didn't really know, like, I can't run, biking doesn't feel good. What do I do? And like going to physio was maybe the worst, you know, like.
I more mean like non-active activities, basically, because that's like, you know, obviously skating is like something you look forward to, something you're consumed by, but you know, you're only doing it a few hours a day, maybe. I mean, sometimes you can do it all day, but so what else would you do to just kind of keep yourself busy? Did you have any little passion projects? Did you have any like little things you were reading or watching? Like, I mean, that's always the big question I have.
Not much, man. It was a pretty low point, and I wish I had a better, more constructive answer, but I don't.
You probably couldn't sit still and read a book or watch a movie.
I had a hard time concentrating. Yeah.
Yeah, because the more still you are, like, the more it hurts. That, dude, I don't know how you got through those 4 years.
And to be fair, too, like, I think that I could be wrong, but I think the average diagnostic time for this kind of condition is like 9 years.
Mm-hmm. Yeah, that's crazy.
So, like, I got fucking lucky.
Yeah.
Just on trying and trying and trying and trying. And again, hitting the lottery. So I did see this physio, which was a total random. My chick, we had lived close to this physio, and I think she maybe had heard something about it. And she just, whatever, hey, maybe for a birthday or Christmas or something, got you an appointment at this place. Try it out. All right, fair enough. Go see this guy. Like I said, first try. Go get this blood test. We'll go from there, you know?
Oh, so he's the one who got the ball rolling with your next rheumatologist where you got the diagnosis?
No, he refers me to my GP, my general practitioner, who then orders this blood test. So
Oh, gotcha. Okay.
yeah, I'm sitting in this physiotherapist's office telling him my story, and he's like, a buddy of mine has this. It sounds pretty similar. You should go check it out. Go to my GP, who I've seen a bunch, and she's kind of just like, an older lady who's like, you skateboard, your back is fucked with all these, a fracture and disc bulges, duh, that's your problem, whatever. So I ask her to get this blood test, and yeah, sure enough, it comes back positive. And she says, okay, do you want to go back and see this rheumatologist? No. Can I see someone else? And so I hit the end of the line with her with the biologics. I asked my GP again to go see a different rheumatologist. Then I kind of come to the realization that this is just the end of the line medication for, this is what rheumatologists are going to be offering, and not to slight them. It's just, I was holding out that like maybe somebody would be like, even this physio guy was like, I think my friend actually just stopped eating eggs.
Oh, damn. Yeah.
So I think that's what first kind of sparked in my head, like, maybe there's just one thing, the classic one thing here.
But that's crazy. I didn't know that stat. You said on average it takes 9 years to get that diagnosis.
I could be wrong, but I did read that at some point. I think it was like 9 to 11 years or something like that.
That's crazy.
Yeah. And that's why that's why it's good you're sharing your story as much as you are, because it's probably just a lack of people knowing about it, Like if it takes that random PT who just, oh yeah, I heard about this because my friend, not even through his profession, you know what I mean? Like it's really interesting.
And I think 2 people had reached out on Instagram and told me about this. And, Instagram, I don't know, like,
everyone's got a story.
In hindsight, maybe I should have checked into this, but you look up ankylosing spondylitis. I wasn't particularly like, oh shit, this is for sure what I've got. I need to check this out.
But it's kind of like I was telling you about my Lyme disease thing. I just had my knees just started swelling up. I was telling Kyle, like, do you think it's, my meniscus tear, like, and now it's coming back, and like I got I was literally asking Kyle, like, do you think it could be arthritis, like, coming in? I'm looking up, Baker's cysts. I had like a cyst on the back of my knee, and Kyle's like, I don't know, like, it
just didn't add up.
Yeah. And like, fortunately, we're in the Lyme Mecca, where literally everyone has dealt on that part of Massachusetts. Everyone has dealt with Lyme disease in some way or another. It might not have been their knees, but it was their elbows, or it was some weird other joint thing. So it's like, just get a Lyme test. So 2 months later, I'm on antibiotics, but I could have been dealing with that shit for the next few years, just thinking it's skate. I've been lifetime of skating. My knees are fucked.
And does that get worse and worse and worse without treatment?
If it's chronic, that's the thing. It's like with these.
It depends. There's just, from what I understand, there's just so many different versions of that.
True.
Right.
Because I've heard of some people who are just like, their life is pretty much over.
Yeah. And it's because it's that sweet spot, though. It's like catching it soon enough. And that's when it becomes chronic. My wife, she has like weird flare up things where she's just like, oh, I'm feeling limey. It just sucks. Like she might be having it for the rest of her life. It's not too severe, but I was like fucking livid. I was so mad. Like, I'm the worst injury I've dealt with in a while. Like, because it was both my knees, so it was just this freaky thing. It's like, it's from a fucking tick bite. Like, I was so mad.
You're a jumper,
but lucky, and I'm a jumper. Yeah, but it's just to say, like, lucky in the same way you are with like finding this when you did. Like, it could have been years of me just like, what's going on with my knees? Well,
what's trippy is that it could have been 4 more years before, based on the statistics, before you got like a proper diagnosis. That's kind of one of the reasons. Like, it was tricky. Like, that's one of the reasons why I really want to have you on. Like, I want people to hear your story, just so that's like on their radar.
Yeah.
But I also want our listeners to know that this is, from what I understand, this is very rare.
Yeah.
Like, I don't want people every time they have a little back twinge to think like, oh shit, I got what Spencer has, like
totally.
It's like a really rare condition that should be on people's radar.
And my issue with the whole thing is, like, I don't know, the States is a little different, but in Canada, like, you can't just fucking do the blood test to see.
Right.
Yeah, that's true.
Err on the side of caution. This guy's been in here a few fucking years. Like, we can't just like, oh, you know what? What are the list of possible things that we can test you for?
Yeah. Yeah. So let me ask you this. How do you wish things would have gone differently within the medical system? How do you think they could have done a better job at figuring this shit out earlier?
Good question. Early on, I can understand how it went the way it went. You know, like I said, so I have this CT scan, I have this MRI, they show this fracture, they show these disc bulges. But any trained doctor should know that most people who have these things don't feel pain. So to just jump to okay, it must be this, it's lazy. It's fucking lazy. And so if someone is consistently coming back, and I'm an athletic guy, you know, like, again, like if I was a doctor, and I don't mean to fat shame anybody, but like, if I'm a doctor and someone's 300 pounds and their back hurts and they keep coming back and they keep maintaining the same weight, like, part of me is going to be like, well, fuck, man, like, this is at least not helping your situation. You know, let's get rid of that issue, and then we can go from here. Whereas for me, it's kind of like, I mean, go home and work on your core. The amount of times I heard that, I'm like, I mean, my core's not bad. I don't know.
Have you seen
like,
my manuals, dude? Have you seen my manuals, bro?
do I need an 8-pack? Like, what are we talking? Yeah,
Oh,
right. Like,
damn. Is core like a triggering word for you right now?
it was. There's a lot of that shit. And again, like, I like. It's not like I don't want to work on my core, but when your back is fucking crazy in pain, and someone's like, just go home and work on your core. Like, okay, thanks for the advice / rest for the next 12 to 18 months.
Physios, make note of that.
Yeah.
Physios, if anybody's listening.
Yeah. So yeah, I don't know. I get where it happened. Obviously, that first rheumatologist, I have a bone to pick with, because I think that was again some lazy lack of.
He was right there.
Yeah, that was an issue.
Yeah. What trips me out is 2014 to 2018. Like, how many video parts did you manage to film during those years? That's what I'm saying.
Like, too, like, if because you like have maintained a steady output of footage. Like, there's not been, in my eyes, like a period of time where it's like, oh, where's Spencer been? Like, you've always popped up with clips or parts. So, like, how the fuck did you do it? I mean, I know you've sort of explained it, but like,
there wasn't much parts coming out during that time. I mean, I don't think there's any real parts coming out at that time. I don't know what the hell I even filmed, to be honest. Here and there, I'd film something for Instagram. I think I'd
couple super parts. Didn't you film a super part or a couple super parts within that?
That Elevate part, wasn't that in that period? I feel like that was like a 2016.
Yeah. So there would have been, that would have been like on Celebrex / I guess in between flare-ups. And that was like on Celebrex, like, I've never skated through so much pain before, ever. Like, this was like real, like, once I kind of figured out, okay, it's not, I'm not worried about cutting a nerve or something, damaging a nerve. This is just inflammation of my joints, and movement kind of helps. I started to let my guards down a bit and be like, okay, push through this. And yeah, if I'm on a trip and I'm at a spot and I'm like, fuck, I really want to get something at this spot, then yeah, I was gonna like, and again, usually there was like a window of like fucking 1 trick or 2 tricks that, like, okay, today I feel all right with nollie flips, I'm gonna run with that, or fakie flips, or I could do a big flip today. That's it.
Damn.
And was just kind of going with that. Okay, I'm at this spot. What does my body feel like it's able to do, And throughout the sesh, maybe things got a little bit better, and manuals tended to feel better. Like, as far as warming up, there was something about that movement that just, the idea of just like going to a spot and skating a ledge was really tough. But skating a mani pad, just kind of some muscle activation, I don't know, that helped.
Well, it's pretty incredible that you were able just to sustain some sort of high level of skating during those 4 years.
I appreciate that. It didn't feel like that.
Well, but hey, like, I'm kind of an outsider looking in, and that's, I think a lot of people didn't think you fell off. You know, you're going through it day to day for 4 years. That's of course insane, but like, you know, like it didn't seem like from afar that you had skipped a beat, you know, which is crazy. Now that I know your full story.
What I really admire you for is that you didn't, I mean, you've seen people come and go in this fucking industry, dude. You could be on top of the world one year, someone who's on top of the world one year, and then 2 years later, it's like, oh, that guy doesn't have a single sponsor, totally out. Like, you've maintained relationships with people, you've maintained sponsors, and you're just still, in my opinion, at the top of your game. And I'm just like so happy for you and impressed, like, that this didn't hinder that, you know, that there wasn't anyone along the road who was like, oh, you know, Spencer's kind of done or something, you know, because it's fucking scary, dude.
And that was lucky.
But it's a testament to your character. It's a testament to your character and you, and just like I'm just really happy for you, dude. It's so cool.
Well, thank you. I'm fucking thrilled that I had the sponsors that I had at the time that I had them, that really held me down, because that would have I can't even imagine what my life would have been like at that time if I had to go to work every day. Like I really sympathize with people who have this thing and deal with it, especially undiagnosed, and are going to work. I mean, you can see why people's lives do just end up kind of becoming shit, because how the fuck could you possibly deal with that, you know? And you kind of like, you know, you just narrow your field of activities down to almost nothing, because this is what feels normal. This is the new normal, you know? Okay, I can only do A, B, and C, and the rest is out. And then you forget about the rest of the alphabet, you know?